Prevention is much more around looking at workplace culture, and in particular looking at a range of psychosocial factors. So things like psychological job demand, management style, leadership practice, workload management, safety in the workplace, the level of civility and respect. So managing psychological wellbeing in the workplace turns out to be a variant on leadership best practice and organisational best practice. So we also need to think about whether we're having a primary, secondary or tertiary response. In other words, primary response is about prevention, a secondary response is about early and proactive intervention, and of course a tertiary response is about responding when things have really gone pear-shaped and people are quite unwell. So it is a complex question, but I think we need to look at it systemically. So we can't just be looking at it with a community psychology perspective about diagnosis, but we really need to be thinking about it from an organisational perspective, including how it relates to the strategic plan and the business plan of an organisation, and how you go about that in different organisations therefore are going to vary considerably. But I think the one thing we can say, it needs to be systematic, and it needs to be well thought through in advance so people know what it is they're trying to get as an outcome.